to focus on that. The disease is transmitted mechanically by the biting flies and mosquitoes. So that's why if you concentrate more on control of vector, 50% of the war against LSD can go. And 50% of the war, other approach is vaccination, making the immunity of the animals better so that they will resist the disease. So that's what I just wanted to share over here. The guideline of OIE says that it is basically a vector-borne disease. The virus belongs to pox virus, Poxviridae family. It has got resemblance with other pox viruses, especially the Capri pox. And that's why, because the vaccine development is a tough task that we have seen for the COVID also, at national level, the NIC in Queens, they have successfully produced the vaccine and it is under the trial. But till that time, the goat pox vaccine is being effectively used, and all veterinary officers, you are there in the vaccination drive, you know that the goat pox vaccine giving little wonderful results, again protecting the lumpy skin disease. Then the most important aspect of lumpy skin disease, social media. As a matter of fact, it is very much beneficial to spread the information, but somehow the social media sometimes act in a different way, and you must be finding on your WhatsApp so many photos. People are affected with LSD-like lesions. It was being spread. OIE strictly says that the lumpy skin disease is not zoonotic. It is underlined and stressed in bold letters that it is not zoonotic. So one need not have to worry about transmission of disease to the human. But as you know, the viruses, they have got adaptability to the different roads. We don't know. In days to come, probably the LSD virus may change its adaptation to the other species and it may become pathogenic. But at present, the LSD virus doesn't have any zoonotic importance. That's why one should not be afraid in approaching the LSD cases and treating the LSD cases. Now, let us go to the next slide. Here is the clinical presentation. What happens in lumpy skin disease? Initially, the fever is there, which we can call it as mid-range to the high fever. 103 to 105 to 106 degrees Fahrenheit temperature has been recorded in LSD cases. Then the typical, the diagnosis of LSD is very, very simple. By looking at the animal, 90% of the cases you can say that it is LSD because its exhibition is very specific. And photographs will tell you, and you will also agree with me, the skin nodules, about 3 to 5 centimeters in size, nodules scattered throughout the body can be seen. They don't have any restriction. Okay, so they are spread all over the body, and these nodules, they itself say that the animal is suffering from lumpy skin disease. Then, apart from that, the systemic involvement is there. Because of the inflammatory reaction going on the body, the animal will lose its appetite, lose its production. Then, the other important feature is enlargement of lymph node. Lymphatic blockage is a very distinct pathogenic feature of lumpy skin disease. And because of that, swelling of different parts can be very easily identifiable in animals affected with lumpy skin disease. Then the edematous tendency. This edematous tendency is because of the compression of the lymphatic tracts. And because of that, the transudate escapes from the vascular system and tries to accumulate wherever the space is. So instead of looking into this, we will go by the photographic evidence. This you can see the rectal temperature 105.2. You can see all of you 105.2. It from 103 to 105, 106 degrees Fahrenheit temperature also has been recorded in the cases affected with LSD. Next, you see here the entire body of the animal is covered with nodules, thick nodules. If you palpate it, they are very hard. Okay. If nodule is there, we try to differentiate whether it's arterial nodule or a thick nodule. So thick nodule means all layers of the skins are affected. Whereas urticarial nodule, it has got a fluid inside. So it is pressable. You can see the difference. So urticaria is allergy. Nodule in lumpy skin disease is very thick. Okay. So, and here you can see our experience during 2020 was the adult animals, they had the skin manifestation of lumpy skin disease, whereas the young calves, less than 6 months of age calf, they had a complication of respiratory tract infection. And now many veterinarians, they are reporting that from the field, the respiratory form is more prominent along with the skin nodules in the adults also. So probably some other pathogen is playing a role in making the respiratory tract susceptible, and because of that, and many reports are there on postmortem, they could able to isolate this Pasteurella-like organisms. They were also joining hands with the LSD virus, causing respiratory distress. So here you can see next. Here also, the entire body of the animal is affected with the LSD nodules. Now this, the third, next slide. The complication of LSD starts with this. The nodules, they lose the blood supply over a period of time, and because of that a line of necrosis surrounds these nodules and the nodule gets sloughed off, and you can see deep crater-like lesions all over the body, and they attract flies, and most of times such cases they get maggot infestation, and a secondary complication also starts. So here you can see next please. Next. Now here you see the LSD in buffaloes, what we have encountered. In northern India, the typical lesions what you see in case of cattle have also been recorded in buffaloes. But in our 1.5 years which we have dealt with the LSD, we have got very few cases of LSD in buffaloes, and the lesions were very, very restricted. Here also you can see the buffalo affected with the LSD, but the lesions are very scarce. They are not present over the entire body. Next, here you can see. Then, next, here you can see a LSD affected animal. From the general appearance itself, you can see the facial edema is there, the edema is extending to the brisket, the edema is also over the lower limbs. So this is because of the lymphatic tract compression, and the fluid oozes out and tries to accumulate because of the gravitation. So this is a very typical presentation along with the skin nodules, edematous tendencies. Next slide please. Here also you can see the entire right forelimb is affected, and the swelling starts from the shoulder up to the fetlock joint. And that farmer probably has applied some locally available medicine, tries to see that the swelling goes off, but it won't go. You have to treat it with it very specifically. In treatment, when we will talk about treatment, I will tell you what are the effective measures to reduce edema in lumpy skin disease. Next please. Now this case, especially I wanted to talk with the field veterinarians. This is a very typical form of LSD. Okay. I think 90% of you are well aware with the traumatic pericarditis. You just forget about LSD. If this picture is presented to you, 90% of you will say that this is a traumatic pericarditis case, because there is a very severe brisket edema, there is a cording of jugular. Okay, these are the two typical features of traumatic pericarditis. But no, this is a LSD case, and about 5 to 10% of the cases they will develop this severe compression of the lymphatic tract. Because of that, the brisket edema is there. The brisket edema is so severe that it also compresses the jugular vein, and because of that, the cording takes place. Apart from that, when we tried to dig out the scientific information on the LSD, I could able to next slide please. Next, here it is. From a journal, there is a publication that there is a cardiac involvement in case of LSD. So this may be one of the reasons, not only the lymphatic tract compression, but there is a myocardial damage in LSD. And this has been proved beyond doubt by an article which has been published long back. So that's why 3 MVC students from Department of Medicine, we made them to work on this. And Jaffer is another one person who has recently published a report that electrocardiographic changes in cases affected with LSD. So that clearly indicates that there is a myocardial damage in cases of LSD, and that may be one of the reasons for this kind of clinical presentation, where the brisket edema and jugular pulsation can also be seen. Then the respiratory distress. By looking at the cough itself, we can say how much of severe respiratory distress is that. Open mouth breathing will be there. And we have treated this case for about 14 to 15 days by nebulization, then by bronchodilators, antibiotics, this, that, and we could able to save this cough. But that is not true in every case. If the case is presented in very late stage, lung damage is there, it becomes very difficult, and that's why people are reporting nowadays. When we encountered LSD, the mortality was less than 2%. But now people are reporting 20%, 30%, 40%. Recently, today's paper, the Yadgir and deputy director has reported about 35 cases they are lost because of LSD. So LSD is, what we have to understand, that is getting complicated. And because of the deaths are there, that we have to understand. And the disease is also changing its pattern. Next. Now here is the ocular form. About 5% of the cases, they show that the LSD lesions can appear in the eyes also. The nodule appears in the corneal scleral junction, and it can cause blindness, corneal opacity and blindness. Next one. Enlargement of lymph nodes, I told you in the beginning itself. You can see almost 4 to 5 finger enlargement will be there. All superficial lymph nodes, they are enlarged because it has got affinity to multiplying in lymph nodes. Now coming down to the therapeutic regimen, what we have to do in case of LSD. By this time, all of you have tried many therapeutic approaches you must have experienced. What we have tried and we got success, that I am sharing. So there are variety of antibiotics available with you, any broad spectrum antibiotic. Okay, and I will share at the last the LSD advisory which has been released by our university, how to differentiate the LSD in different forms and what should be the treatment criteria. So a generalized statement is any broad spectrum antibiotic should be preferred. Here we used to give emphasis for fluoroquinolones. Enrofloxacin was the drug of choice when we treated LSD cases. In about 90% of the cases we got results. The approach is, if a mild case is there, you give enrofloxacin which is long acting at around 8 to 10 milligram per kg body weight, so that the person or the owner did not have to present the case repeatedly. Once you give the injection of enrofloxacin long acting, it will remain there with the patient for at least 72 hours. Give one antibiotic, long acting antibiotic, and wait it, just discharge the case, let it be there along with the owner at his place. If severe case is there, then you may have to give a short-acting enrofloxacin at 3 to 5 milligram per kg body weight. Okay. Then the next important aspect is the anti-inflammatory. Which of the anti-inflammatory drugs they are effective? We have a list of anti-inflammatory drugs which has got some of them they are having more antipyretic action, some of them they are having COX-2 inhibitors, they are having better anti-inflammatory activity. So here we used to give emphasis on meloxicam and paracetamol combination. You have a choice. You have got sulfonamic acid at your end, which is much more potent than meloxicam. You have got phenylbutazone at your end, which also can be given as a better analgesic. So flunixin meglumine is also another anti-inflammatory drug which is available, but it is at a costly rate. So by looking into the economy of the farmer, you have to choose the drug. We used to give emphasis on meloxicam and paracetamol, which will combinedly not only treat the pyrexic reaction, but it will also act as an anti-inflammatory agent. Acute respiratory distress, what we have seen in case of young cows, which is being experienced in adults also. we suggest that ceftriaxone-tazobactam combination is the best one, and we have got 3.3 grams of ceftriaxone-tazobactam combination available in the market. So that can be used for first 2 to 3 days by intravenous route, followed by intramuscular route for another 2 to 3 days. So we have got better response with the ceftriaxone-tazobactam. Nowadays people are using cefixime also. 5th generation cephalosporins are also available. That also can be tried in severe and affordable. If the owner is able to afford the treatment, you can go for a higher cost antibiotics also. Then all of us, we know that the skin reaction is there, histamine release is there, antihistaminic should be the part of your therapeutic regimen. Phentermine and chlorphenamine maleate should be there in your therapeutic protocol for having an antihistaminic. Then fluid and electrolytes, because the animals are not taking any feed, they are anorectic for so many days, and so that's why fluid and electrolyte support along with the dextrose. You can think of Ringus lactate and DNS. Sometimes even hypertonic dextrose can also be given to give immediate energy. Now the other out-of-box approach for the treatment of LSD, vitamin C. Now vitamin C, we have seen that, and it has been documented also, it is antioxidant, proven beyond doubt. It promotes tissue healing, which is very much important for the healing of LSD wounds. And apart from that, ascorbic acid is also having a cardioprotective effect. So that's why vitamin C on a trial basis, we have used it in cases of LSD in our OPD, and we got a very good response. In adults, around 1000 milligrams of ascorbic acid has been given for about 3 to 5 days. Whereas in young cows, about 300 to 500 milligram of ascorbic acid or vitamin C has been tried, and in all the cases we could able to see, if you compare with the placebo, vitamin C treated cases, they have shown improvement at a much earlier time. Then the fluid retention we were talking about. When edematous tendencies are there, people always, they so many veterinarians, they keep on calling me and asking me how to. See, the lymphatic tract compression will not go so easily. So that's why you don't expect a magical repair in case of edematous tendencies. Edema will stay there for about 1 to 1.5 weeks, in spite of giving any kind of treatment. So what you have to do is furosemide, which is a diuretic, which will improve the lymphatic circulation as well as drainage of fluid. Around 2 milligram to 4 milligram per kg body weight can be given for at least 3 to 5 days. But compensatory fluid and electrolyte balance has to be checked so that it will not cause so much of dehydration also. Then here in few cases we have tried the immunomodulation by injecting levamisole. Levamisole is anthelmintic as a matter of fact at 7.5 milligram per kg body weight, but it has been documented if it is given at a lower rate of 2.5 milligram per kg body weight, it improves the immune response. It acts as immunomodulatory drug. And we have seen in about 10 cases we have tried this levamisole injectable, and we could able to see that these cases they recovered from LSD at an earlier stage when compared to non-levamisole. Then this is all about what we have done, and you can share your experience also. Now we should have an open mind for accepting the alternative medicines. I am a Joint General Secretary for Indian Society for Veterinary Medicine. Last convention which was held in Bangalore, we have taken up a decision, and we have communicated also to the government that there is always a question. We don't have any Ayurvedic syllabus in our BVSC curriculum. Neither we are introduced to homeopathy. Whether veterinary doctor is able to, should be considered as an Ayurvedic practitioner, whether he can prescribe or not. All of us, we know that since ages together, Ayurveda is being in the treatment of animals, isn't it? We should have an open mind, and that's how the role of alternative medicine has to be explored in such kind of cases where the treatment becomes difficult, and it should be more affordable also. So there are even the Ayush has come to the from National Forum. They have said that the Ayurvedic products should be tried in the cases of LSD. Recently, our director of animal husbandry also has envisaged to our veterinarians that Ayurvedic products which are available can be tried to take care of the LSD. So here some documented evidences are there. Here you can see there are certain proprietary drugs are also there, but it is not a forum to discuss about proprietary drug. But Guduchi or Gulwel is a Dinospora cardifolia. So this is the drug which has changed the outlook towards COVID. Okay, so this Gulwel is having a immunoprotective type of properties, and that's why they say that the Gulwel, then the ginger, the adrak, turmeric powder, neem leaves, betel leaves, the proportions have been given over here: garlic pulse, coriander, curcumin, black pepper, bay leaves, and jaggery. So you have to make a paste of it, mix it in jaggery, make small boluses or laddus, and this can be given twice a day or thrice a day because it doesn't have any side effects. So people have reported that one monthly magazine is there which deals with this Pashudhan Prahari. In that documented evidences are there that if you try this, the LSD, the severity gets lessened over a period of time, and the pain associated with can also be reduced. Likewise, the homeopathy is there. There are so many medicines which are being promoted for the treatment of LSD. Now this, especially next page. Next. Yeah, this is a LSD kit, they call it as. This is a homeopathic medicine which can be given intranasally or orally also. And it comes in 2 or 3 formulations. One is for the topical application. The one is for the oral, drenching. Like homeopathy, all of us we know that either it comes in globules or in the form of mother tincture. So around 8 to 10 drops are enough for even adult cattle. So this has been tried by many veterinarians, and there are specific homeopathic medicines are also there which have been found effective in the treatment of LSD. Then what is the future scope for the LSD? What are the other things which we can think of? The first and foremost thing is antiviral antibiotics. All of us, we know that how remdesivir has created a wave in COVID. Antiviral antibiotics, we are skeptical about its use in veterinary practice, except in few cases. Okay, so that's why basically the problem with antiviral antibiotic is the cost. They are very costly, and that's why they are not affordable. But in case if it becomes affordable, there is always a scope for trying antiviral antibiotics in the LSD. Then the newer type of non-steroidal anti-inflammatory drugs. Then use of steroids. Many of you must have tried also, but I have reviewed. I have gone through the literature. They say that the steroids. We say that around 50 times anti-inflammatory effect is there with the steroid. That's why they are better anti-inflammatory when compared to the commercially available COX-1 and COX-2 anti-inflammatory drugs. So that's why we believe that steroids can have a wonderful effect in case as an anti-inflammatory drug. But the major side effect of steroids is immunosuppression, which we don't want to happen in an animal which is already affected with LSD. But still, the low-graded steroids can be used, and people have used even. There are veterinarians which keep on talking about use of prednisolone in the cases of LSD, and the newer antioxidants. Now, current status, next, prevention and control. As all of us we know that there is a vaccination drive going on throughout the Karnataka and Maharashtra. Even Maharashtra, they have made the district-wise zones, and veterinarians have been asked to take the local help and then start the vaccination. Entire population they want to vaccinate. So here also district-wise the vaccination drive has been taken. Goat pox vaccine, I have been told actually the recommended dose is 2 ml for the adult cattle, but I have been told that we are using 1 ml in the field. Is it true? Yeah. Okay. So it is only an alternative measure of preventing the lumpy skin disease, because you want to make the animal immunocompetent by exposing the animal to a vaccine which has got a similar virus. So that's why 1 ml is also giving a wonderful result in the field, but the actually recommended dose of goat pox vaccine in case of adult cattle is about 2 ml. And as I told you, the NRC, National Research Center for Equines, they are already successful in developing the COVID vaccine, and it is in the trial run. In maybe another 6 months' time, the vaccine will be available, and let us see this vaccine will bring a new hope for the control of lumpy skin disease. This is what I wanted to share with you. Next one, LSD advisory, please focus it. One more file is there. We released about 2 weeks back for the benefit of veterinarians. So you please enlarge it. So here you can see first one, green. So here we have advised the veterinarians to categorize LSD into 3 forms. One we call it as mild. Very few skin lesions are there here and there. There is no involvement of respiratory tract. Animal is little bit dull, but partially food intake is there. Such cases has to be categorized as mild cases, and then this is the treatment protocol which has been advised. You can give the same thing I told you. In such cases, long-acting fluoroquinolones around 8 to 10 milligram per kg body weight can be given, and you can wait, because these will not directly end up into a severe form. You have to just take care that secondary bacterial complication will not result, and the LSD in that case will not complicate. But you have the second category many times. Out of 100 cases, 50 to 60% cases they are presented in the LSD form, which is complicated. Okay, so here respiratory signs are also there. The entire body is affected with the LSD type lesions. In such cases, we advise you please enlarge it. See, high fever, partial to complete anorexia, lacrimation, nasal discharge, that shows that respiratory tract is being involved. Moderate enlargement of lymph nodes, entire body is covered with the lumpy skin lesions. Here what we advise is enrofloxacin, 3 to 5 milligram per kg body weight every day for about 3 to 5 days. Chlorpheniramine malate, but 0.25 milligram per kg body weight every day for about 3 to 5 days. Meloxicam, 0.25 milligram. If you find the fever is little exceeding beyond 103, you can choose meloxicam paracetamol combination or even analgesic. B complex, just to improve the disease status of the take out the animal from the disease status. Vitamin C, as I told you, 1 gram per adult, 250 to 500 milligram for the young one, and ivermectin. In Maharashtra, they have made it as a mandatory. Whenever the LSD case with severe lumpy skin lesions are there, they know that they are going to these lesions are going to be complicated, and maggot wounds are 99%. It is going to happen in such cases. So ivermectin has been included in the protocol for the treatment of LSD. Now, some of you may pose that even in COVID also, human doctors, they were prescribing ivermectin. Now, there is always a controversy behind a suggestion. Ivermectin has been found to be effective against the COVID virus, but the COVID virus is little bit different from the pox virus. Okay, so that doesn't happen in case of LSD. Our main focus is the complication of wounds. So that can be avoided by the use of ivermectin. The third, severe form, please focus it a little more. Critical form we call it as. Critical form is, enlarge it a little bit. Go to the clinical presentation. Complete anorexia, high fever, multiple skin nodules involving all layers of the skin, mucopurulent nasal discharge, respiratory distress, deep ulcerative, crater crater-like necrotic lesions on the body, swelling of limbs. Available in the eyes, corneal opacity and all. This is critical form of LSD. Here we advise, instead of enrofloxacin, ceftiofur or ceftriaxone tazobactam should be the choice of drug. Ceftiofur 1.1 milligram per kg body weight also has been tried with effective outcome. Chlorpheniramine malate, same dose, meloxicam, fluoxetine, meglumine. In higher form of the LSD or severe form of the LSD, we advise fluoxetine, meglumine rather than meloxicam. B complex, go down. Vitamin C, same protocol, ivermectin. So it remains the same what we have seen in the complicated form of the LSD. And the treatment depends from 3 to 5 days for the uncomplicated form of LSD, and 5 to 7 days, even up to 10 days in case of a complicated or critical form of LSD. Apart from that, these general guidelines are there. In case of edematous tendencies, furosemide 1 to 2 milligram per kg body weight can be given. Then good palatable diet should be available. Then control of vectors is another priority, and preferably vaccination and all. So this is what we wanted to share on these diets against what are the things which we can think of controlling and treating the cases of LSD. If you have any questions, if you have got any queries, the dais is open for the discussion. Thank you very much.